Speaker recognizes Representative Prestin.
Thank you, Madam Chair. It is an honor to speak in favor of House Bill 4309, which will enter Michigan into the Physician Assistants Licensure Compact. Access to care for patients across the state faces many roadblocks in the state of Michigan. The state's licensing system has a long history of creating unnecessary obstacles to healthcare access. The state of Michigan treats out-of-state medical professionals as unqualified unless they navigate its complicated and burdensome requirements. These artificial barriers, rooted in an outdated assumption of incompetence, restrict the supply of providers, exacerbate shortages, and limit care, particularly in unserved rural areas such as my area in the Upper Peninsula. Access to care for patients across the state faces many roadblocks in the state of Michigan. Out-of-state medical professionals are treated as unqualified to perform the job and are forced to navigate complex maze of Michigan licensing. Sometimes these licensing roadblocks are set up intentionally as a protectionist barrier by in-state medical professionals looking to box out competition. Instead of assuming incompetence, we ought to be extending a helping hand and expressing our gratitude to these health professionals looking to come to our state. In this instance, these roadblocks existed because there hadn't been an alternative until very recently. I'm proud to report that the Physician Assistant Licensure Compact reached its activation threshold last year, and the first compact privileges will be issued early next year. Currently, 16 states have enacted the compact legislation, and 11 more are considering the legislation to be added. Madam Chair, this legislation ensures that our state will be able to more easily recruit new PAs from across the country who want to live in our beautiful state. It will ensure patients who are traveling will have easier access to their healthcare providers via telemedicine across state lines. It will also ensure that hospital systems in border communities can access professionals from the other side of the border in times of crisis. This legislation reflects the deregulatory mood of this legislature. This bill tears down artificial regulatory barriers, implements common sense measures that increase access to care. I urge my colleagues to vote yes. Thank you.